love somewhere quiet.
This is the sound of doctors practicing medicine, at least a dozen of them working with support staff and experienced colleagues.
The patient and they're
Some of these doctors are second-year students from the UC San Diego Medical School. The classroom on this particular Wednesday evening is the free clinic housed in rooms and an auditorium at Pacific Beach United Methodist Church. JUSTINE is the designated clinic general manager. She's a second-year medical student who survived her first-year program, gripped in the chaos of COVID-19.
It was just really inspiring seeing everybody really unite in order to address this pandemic. It really showed me that you didn't have to be directly in the front lines in order to fight the pandemic.
Hand and wrist. Negative.
Dr. NATALIE Rodriguez is the UCSD Associate Clinical Professor and mentor to these students. She was a young medical student herself when she started volunteering at the free clinic 20 years ago. 13 years ago, she became the attending physician who now beams with pride when talking about her students.
They bring their enthusiasm, their compassion, their passion, their innovation, especially this past year with COVID.
This church building provides a lifeline of health care for those who need it the most. It is a free clinic, but the quality of care is professional and would not be possible without the backbone of medical students who show up every week to run it.
The only time Justin was ever in the hospital was for his birth.
Dr. Rodriguez and her students are back to in-person classes on the UCSD campus this fall after a year of distance learning, the critical first year of medical school.
No strabismus that I can see.
Morgan is happy to finally be in person and in community with her other classmates who also trudged through a year of Zoom classes. Morgan preferred to give only her first name as she shared personal memories and her experience, like the first day of medical school at home.
Our education was, some people would say, disrupted. We value all of the clinical work that we have just so much. It's like working at the free clinic, getting to see a patient, getting to do a physical. It does just make you appreciate the opportunities that you have when you understand that they could be taken away and that they could have been very different.
Despite the challenge, second-year student URVI GUPTA never gave up hope. After spending the first critical year of medical school in distance learning, she also dealt with the devastation caused by COVID-19 in her family's home country of India. If anything, she says the experience will make her a better doctor.
No matter what the medium, what the platform, our first priority is always just making the patients feel comfortable and making sure we're providing excellent care. And so I think this past year has shown us that no matter what the situation that we're put in, we can do that.
Looking for things that are more concerning.
The COVID shutdown did not stop the Wednesday weekly free clinic in Pacific Beach. It did cut the staff to just a handful of doctors who didn't see patients in person, but instead coordinated drive-by drop-off delivery of medication, online consultations, and vaccine education sessions when the vaccines became available. And these then first-year students also encountered a sudden lesson in social justice.
We had just come off of the Black Lives Matter protests, and it really just exploded this entire introspection into racial injustice and just health equity.
In fact, the racial divide triggered in 2020 inspired the creation of a new enhanced health equity curriculum at the UCSD Medical School, engaging students in how to treat people of different beliefs and backgrounds. Dr. Rodriguez could not be more proud of their accomplishments.
It just gives me so much hope for the future of medicine, knowing that they're going to go out there and make such a difference in the world and in healthcare.
That's some good medicine we can all use. M.G. Perez, KPBS News.